This is going to be the Student Clinical Orientation Packet at the EMT Program, Redlands Community College. And the Program Administration consists of Sean Rogers, who is the Program Director, and Mary Pugh and David Gushaw, who are EMT Program Clinical Coordinators. They're the ones that you'll deal with primarily with your clinical experience at Redlands Community College. Program goals: provide quality education, encourage professional growth, improve emergency standards of care, recognize special needs of EMS in rural and frontier areas, and promote advancement of EMS education. That would be at the local, state, and federal levels. Expected outcomes from the student: you must make a minimum of 80% on all written exams and in the overall score. Complete 100% of all practical skills, and this is with an 80% overall outcome, not including the critical criteria. Now, some of our psychomotor skills require you to have specific critical criteria. You cannot miss any of those. So a score of 80% overall, not including the critical criteria. Pass and complete 100% of all clinical and field rotations. Minimum didactic lab attendance of 85% of the scheduled time. And there's no exceptions on that. A minimum clinical rotation attendance of 100%, and that would be no exceptions on that either. Student responsibilities: you must disclose and provide documentation of any special needs that you have or accommodations. This would be accommodations for learning disabilities or anything along those lines. Some accommodations can be met, but written documentation must be provided to the program director and the instructor of that course. Adhere to all program policies. The student handbook for Redlands Community College can be found on the current students page of the Redlands Community College website. And disclose any felony convictions that you have. Exhibit respect for everyone that you come into contact with. Report any academic issues immediately, and report any personal issues immediately. Student responsibilities continued. Report any clinical issues that you might have immediately. Report any absences immediately and in ample time prior to the absence. Submit any and all complaints in writing within 5 days, and these include problems related to the EMT program, instructors, staff, or clinical affiliates. Student responsibilities continued, and immediate reporting of any changes to your name, address, telephone number, email, or health. Dress in clinical uniform for every class, and this is an optional thing for distance learning students. Student responsibilities continued. You should submit for a random drug screen, and this is at no cost. This will be scheduled prior to your start clinical date. Items prohibited on campus include firearms, alcohol, and illegal drugs, and all tobacco products, and that would be except in designated areas. For enrollment in clinicals, then this would be almost a step-by-step process here. First of all, you need to get onto Clinical Hub. This costs nothing to the student. This can be achieved at www.clinicalhub.net. Next thing you need to do is get enrolled in FSDAP. Now, FSDAP is how we track your clinical competencies. And the EMT program, EMT Basic, is $30. All other levels are $80 for FSDAP. And you can start this process at www.fsdap.net. Obtain an OSBI background check, and this is $19, and it is good for 1 year. And we need you to get a background in violent offender, sex offender, and a general background. And the cost of that is $19 through Oklahoma State Bureau of Investigation background check. Obtain a Group 1 background check, and this is $45 student cost, good for 1 year as well. And this is done through www.gp1.com. And again, obtain violent offender, sex offender, and general background information on this. These will need to all be submitted to the clinical coordinator. Let me explain one thing that people have a question about sometimes. Both of these are good for 1 year. That means if you do not complete your clinicals in a timely fashion, these are only good for 1 year. So you would have to resubmit these two to continue on in clinicals if you go outside of your 365-day time frame. More information on this, you can contact the clinical coordinators. They'll be able to get you some more information on that. However, since the paramedic course is 14 months total and 3 months of that is taken up by A&P refresher, you should be able to plug in to your appropriate clinicals and finish appropriately on time. Required paperwork, shot records, these are also required to be given to the clinical coordinator prior to the start of your clinical experience. Varicella zoster, which is chicken pox. Immunization is a series of 2 shots, or you can obtain a titer, and a titer is a blood test that says that you have the antibodies required for that specific immunization. An MMR, measles, mumps, and rubella, and this would be 2 of these before 18, or 1 of them after 18, or you can get a titer as well on this. Hepatitis B series, now this one here is optional. So this one is optional and the only one. And you can get a signed declination form for this if you don't want to receive the hepatitis B series, or you can get a titer for this as well if you've already had them in the past. An influenza vaccine, H1N1 or seasonal, will be fine. There is no declination form for the flu shot. In case you are allergic, you will need to provide a doctor's note of such, and that will do just fine. NIMS 100, 200, 700, and 800, and most of us have experience with this. Need to have all of these papers put in a file and essentially got to the clinical coordinator. A PPD, this is going to be a TB time test, the skin test, in the first year at Redlands Community College, or a chest x-ray verification if you're allergic to that. Copies of all your licenses and certifications. Required supplies, pen, pencil, paper for notes, textbook, calculator. Digital tablet is optional. Otherwise, you must scan in the clinical paperwork that you have on clinicals, and that must be to the clinical instructor within 5 days after the clinical. Uniform must be worn for inspection 2 weeks prior to the beginning of clinicals. Black or navy blue BDUs, blue uniform shirt, which is a normal EMS fire uniform, black boots with non-skid soles, a black belt, trauma shears, and this is required supplies continued, pen light, stethoscope, pen and paper, an EMS field guide, not required, but it's kind of good to have, and then course books for downtime study. A few more on the required supplies. Redlands Community College student, and this would be the EMT patch, worn on the right shoulder, EMT Program ID, which is obtained through physical plant, and clinical packet, digital tablet or paper form, either one. Scheduling. Scheduling clinicals will be done so 90 to 100 days at a time. Availability will be given to the clinical coordinators. Please remember that hospital clinicals have specific availability. Missing of any clinical may close your window on that opportunity. So an example of this, they only have certain slots at certain times of the year. So if you're scheduled for an ICU clinical or a specific pediatric clinical and you miss it, there may not be a slot for you to make that up. Just so that everyone's aware of that. Clinical requirements. Clinical shifts must be scheduled a minimum of 2 weeks prior to the shift. Clinical shifts must be, and that would be a minimum. Please don't get that confused with the other page. This is a minimum of 2 weeks. Clinical shifts must be scheduled with the program clinical coordinators. Report to a clinical site no less than 30 minutes prior to the beginning of the shift to meet with your clinical preceptor, and most commonly they meet in the actual lunchroom or the actual cafeteria of the hospital. Attending any unscheduled clinical shift will result in your immediate termination. You can't just show up to clinicals and perform a clinical shift without either a representative of the college or have it scheduled. So you can't just show up to clinical shifts. Clinical requirements continued must be In required uniform, as previously described, and this would be blue BDU pants and light blue t-shirt, EMS Fire t-shirt, with all previously cited items. Notify clinical coordinator in advance if you cannot attend. If you'll be late, call. It's at the clinical coordinator's discretion and the preceptor's discretion. Most of the time, they will cancel the clinical and reschedule. Again, if this is a specific hospital clinical, you may not have the opportunity to reschedule. All clinical paperwork must be completed by and signed by the end of each clinical shift. Now, the digital paperwork with captured signatures must be emailed at the end of every shift. And see the clinical paperwork section. We'll kind of overview that and put a couple videos up. All FISDAP entries must be completed within 24 hours of your clinical. You have 5 working days to get the signature items to the clinical coordinators. And this would be if you do not opt to do the digital forms, the signed clinical sheets, your assessments, must be given to the clinical coordinators and your instructor within 5 working days. Behavior must be courteous, professional, ethical, and exemplary at all times. Be alert when around sterile fields. Be alert when learning opportunities are possible. If you get an opportunity to go to cath lab and your preceptor allows it, go to cath lab. Mobile phone or other technology usage during a clinical shift. An example of this would be Facebooking, except before a shift, during lunch, and after the shift, will not be tolerated. Phones must be turned off while in clinicals. If you are annotating on FISDAP or the evaluation forms, ample time will be provided to you at the end of the shift so that you can catch up on these forms. Until then, in the middle of the day, take notes on each patient that you interact with, and so that you have notes to be applied to the FISDAP. Remember, they're due within 24 hours. Never perform any procedure for which you have not been trained, and this would be trained by the hospital staff or trained by your EMS education, or is not within your PC1 skill set. Never question patient care in front of the patient family and or friends. A side note is always the best preferred way to do that, and talking to the actual preceptor, the nurse, and or doctor. Never violate HIPAA. Never seek free medical advice. You are not there to be treated. Very simply, you are there to have a clinical experience. Never eat, drink, chew gum, or use tobacco. And that is while you're in the clinical. If you want to go do that on your break, that's a different story. But while you're in the emergency room interacting with patients, let's not chew gum, let's not eat in front of them. Don't eat a sandwich, take it back to the break room, and no use of tobacco in front of them. Never enter an EMS vehicle without the crew's permission or authorization. Never shut off an EMS vehicle or take the keys, and never give out phone numbers of the EMS persons or other contact information of any agencies or staff to patients and or family members. Clinical requirements continued. Never wear jeans, hats, or caps, service affiliation patches, pins, or jackets, excessive jewelry, or any kind of medical pins. Never wear fragrances that might be offensive, or any facial or oral piercings while on clinicals. Clinical packets. Complete the parking decal card. All the info on the front side of the card, please print it legibly, sign and date the back side of the card, and turn it into physical plant. On the student information sheet, print that legibly and check out all documents being provided either today in person or by located on the Schoolology website. All of these clinical packets and all of the forms will be found in the files section of Schoolology if you're looking for them. There will also be a checklist there. Clinical packets continued. Be sure, whenever you sign all of these, that these get back to the clinical coordinator. The IMSA Release and Indemnification Agreement of Understanding, Integris's Health Seasonal Influenza Prevention Program Sheet, Integris's Health Confidentiality Agreement, OU Medical Center Information Form, OU's Confidentiality and Security Agreement, be sure that that's signed. Be sure and look over the OU We Will Excel, and take the quick OU test. Now, this is all turned in by hand and PDF, and be in PDF document in the files section. For NESA, whenever looking at the NESA requirements, all of these have to be done as well before you start clinicals. Review all the video lecture, take the online test, Print the OU packet and sign and take the test attached, and that's what we were talking about in the previous slide. This can be scanned or mailed to the clinical coordinator, but be sure whenever you scan it that all of your documents, and there will be a checklist, like I said, must be completed before you start clinicals, and all of it comes at one time. Don't give it in parts and pieces. Give it all at once. Contact information for the program director by his mobile, and this is Sean Rogers, is going to be 405-326-2087. Email can be reached at is ross.rogers@redlandscc.edu. Mary Pugh, Program Clinical Coordinator, office phone 405-422-6240. Mobile is 405-314-7844. And email is mary.pugh@redlandscc.edu. Or David Gushaw, which is also a clinical coordinator, mobile of 405-274-3746. And email is gushawd@imsa.net. Any questions, please feel free to contact us at any time, and thank you very much for your time.